Hunger, a real-world issue by Nicole Daniels. An interdisciplinary approach is the study or research that draws from two or more disciplines in order to gain a more well-developed perspective. One current issue to look at within an interdisciplinary approach is U.S. hunger. Feeding America states and approximately 35 million people of the U.S. population live in areas without nutritious foods, have low access to a vehicle, and challenges accessing nutritious foods. The lack of access mostly affects low-income families. 14.3 million American households struggle with food insecurities. We're going to discuss the hunger issue in Mississippi. Mississippi has the highest rate of food insecurity in the U.S. Two discipline approaches to focus on of hunger are geography and public health. I will be explaining how these two disciplines affect hunger in this video by using a comprehensive approach from my two disciplines. The concept of location and socioeconomic statuses are the main focus of determining food accessibility. An interdisciplinary approach using a discipline in human services and child development and family studies provides a solution. You will understand this by being able to understand how societal programs, policies, and contexts affect the lives of children and families in human development. You will also be able to know how to work with various locations and diverse populations. An interdisciplinary approach is an effective solution to such problems by eliminating the gap between sciences and providing a more practical response. The food insecurity problem needs interdisciplinary approaches with social science, economics, and the humanities, which all play critical roles in addition to health sciences. Food is one of the basic human needs, and providing it is directly related to food security. The human service field is an interdisciplinary profession that focuses on ways to improve social problems and the quality of life for families and communities that may have been or are currently being faced with oppression. Child development and family studies is also an interdisciplinary profession that allows us to be able to understand how societal programs, policies, and contexts affect lives of families and children in human development. Feeding America argues that Mississippi, the hungriest state in the U.S., 20.8% of households are at risk of hunger. In Mississippi, most people's ethnicity is African American, with a percentage of 37.8%. In Mississippi, 600,000 people are struggling with hunger, and of them, 162,000 are children. People facing hunger in Mississippi are estimated to report needing $300 million more year to meet their food needs. The average cost of a meal in Mississippi is $2.90. In relation to this, Mississippi is known as the poorest state. For many Mississippians, the most convenient way to buy food on a day-to-day basis is to buy junk food from a local convenience store. Due to the total lack of grocery stores made available in the state, the food eaten by Mississippians is often cheap and has minimal nutritious value. SNAP is able to provide some help to individuals experiencing food insecurity, but provides minimal financial assistance. However, it is often quite difficult for citizens to be able to acquire SNAP benefits. Eligibility requirements to access SNAP in Mississippi are the most strict in the entire country. From the lack of public transportation and financial ability to acquire a vehicle, counties in Mississippi, such as Esquina, suffer from serious economic loss due to citizens having to redeem their SNAP benefits outside of the county. Despite Mississippi having vast rural and agricultural areas, Mississippians are getting what the state has to offer in terms of fresh produce. In fact, 90% of the food that citizens consume is imported, with most of the agricultural areas in the state producing mainly soybeans and cotton. The lack of healthy food that is available to the public creates high rates of disease. Healthcare costs can be as high as 50% in houses with food insecurity compared to houses with no food insecurity present. The Move for Hunger argues that food insecurity is even worse for Mississippians who are members of the marginalized racial and ethnic groups. Mississippi, like many southern states, still bears the scars inflicted by slavery. Areas in Mississippi that are without access to food are more likely to be populated by African Americans, Hispanics, and other ethnic groups. Of the 670,000 recipients of SNAP in Mississippi, 61% are African American. 31 of the counties have a population of African Americans of over 40%, with 22% of the counties having an African American population of 50%. With the highest rates of poverty in the country, restrictions that deny access to benefits, high health care costs, the lack of grocery stores, the lack of nutritional food available, the institutional racism that negatively affects marginalized racial groups, it is easy to see why Mississippi suffers from food insecurity and poverty more than any other state in the nation. So the question is, what can we do about the hunger rates in Mississippi? Mississippi is not the only state with this issue, but it is the state with the highest rates. The Feeding America Network is able to reach 40 million people, largely thanks to the commitment of volunteers. Our communities are stronger when we join together. You can help give your neighbors a hand by volunteering at your local food bank. Another way to help is by a combination of charity and government assistance programs. They are helpful in bridging the gap. SNAP provides a temporary help. You can also become an advocate. We need our lawmakers in Washington to help fight the fight. We the people can get this complete by expressing the need in Mississippi. They need to understand this and put hunger as a main priority. Together we can solve hunger.